Hello, viewers. This is your girl Alex Ainembabazi. When it comes to contraception in Uganda, a number of young girls face challenges, or there are some issues that hinder them in accessing these contraceptives. Today we are in Yumbe, and we have one of the youth leaders who is going to be telling us a number of things when it comes to contraceptives, accessing contraceptives with these young people. He's going to introduce himself, and then we shall get to know more about these contraceptives as we go forward. You are welcome.
Thank you.
Please introduce yourself to our viewers.
My name is Isaac James, the RWC3 leader for Zone 3.
Okay. So, Isaac, the number of things that happen when it comes to contraception, right? So we would like to know if young people, especially in this area, know about their rights when it comes to bodily autonomy. With bodily autonomy, what we mean is, do they know they have a right to decide when it comes to their own bodies?
Yeah, it is true. They have the rights. As we, the youths in Zone 3, we are doing awareness in the communities on how to make them to know that they have rights on themselves. And we have some partners that they are supporting us also in that awareness, like IRC, VSO, they're also with us.
So what are some of these things that you do that help these young people to know that they have the rights?
Yeah, like when they come to contraceptives, the ladies, they have rights to medical care. And also when they conceive also, they have rights. They have the decision to make. Yeah.
Since you've said that you try to let them know that they have the rights, do they normally go to the facilities to get maybe services for family planning or anything to do with contraceptives?
Yeah, they do move to the facilities. Even sometimes some of the health workers, they do move to the communities also, taking those services near to them. Yeah.
As they are going to these facilities, what are some of the challenges they face in accessing these services? Talk about family planning or maybe abortions. What challenges do they face normally? Yeah,
at the facilities, the youths, they are lacking this SRH place private for them, because they do fear when some of their elderly parents are there. So when they are there, they do fear to come. And what also I need from them is that they say that there's no confidentiality when they come for HIV testing at the hospital. That's why they also do fear to move. And they feel like if there's possibility, let the livelihood partners construct for them a separate structure whereby they can access those services. Yeah.
From that conversation, that means since young people fear to come to the facilities, chances are high that they could conceive. Because, I mean, how are you going to get family planning when I've not gone to the facility? I don't know, right? Are the chances high for them to get pregnancies in here?
Yeah, there are very many chances of getting pregnancy. As we, Zone 3, Kulusa County, we are the one leading in teenage pregnancy as per now.
So what do these young girls do when they get unplanned pregnancies, or someone gets pregnant and they are not ready for it? What do they normally do?
Sometimes some of their parents, they don't respect their rights. As they have seen their child or their daughter have conceived, they normally chase toward the husband's home that since you have conceived, you are no longer going to stay with me. You go to your husband. And those are some of the challenges that also you are facing. Now,
assuming maybe one has not been chased and they stay with their parents, then what? Or I'm also looking at these scenarios where a girl has conceived, is pregnant, but they do not want their parents to know, because if the parent knows, that means they're going to chase us from the house, right? So what do they do in that case?
Yeah, sometimes that is now the extent where it leads them to this crude abortion, as sometimes they may do it with themselves, Then by the time some of the health workers, the VHTs knew that, when they are now in a bad situation, and also they bring her to the hospital. Yeah.
Now, as they proceed with these abortions, what do they normally use in this area? Because just like you've said, that means that by the time they reach to the VHT, or by the time the VHT gets to know, they have already done the abortion, right? So that means the abortion they have done is not safe. So what do they normally use?
Yeah, what I heard is that they're using these herbal medicines. I don't know, there's some leaves that they're using for it. Mostly those ladies, they know it, but for us, we don't know.
So I need to find out from a lady. Maybe they can tell us more what they use, or which leaves they use, or which herbs they use when they are trying to carry out these abortions. Last but not least, we'd like to get your idea on this. You know, oftentimes there are a number of people that make decisions for girls in a community, any community, be in school, be it home, be it anywhere. I would like to get your opinion. Do you think between a VHT and a young girl, who should be making decisions for young people?
Sometimes some of the young people, they can mess up in making decisions, and I'm trying to say that VHTs sometimes are the one making for them decision.
So right now VHTs are making decisions for the girls. Like some VHTs are making decisions for like young people, young girls and all that. Is that what you're saying?
Yeah, they guide some of these young adolescents on how to prevent themselves in some of those situations.
Okay. Do you think it would be okay for a young person to be the one making the decisions instead of the VHT? Or you still stick to the VHT to like make a decision?
Yeah, they can make decision, but if I'm to compare in percentage, at least their decisions will range at 80%. Then the 20% will be guided by the VHTs.
Okay, so the young people can make decisions like 80%, the VHT at least does the 20%. Okay, thank you so much, Isaac, for those words. So just like Isaac had told us, a number of girls here, in case they have failed to get contraceptives, they opt for abortions, and the abortions are not safe. So by the time they reach the facility, their health is at stake. So we are not sure if they are going to survive or not, which is absurd and which is, affecting their health in one way or another. Thank you so much again. It is very important for these young people to get to know about these contraceptives. Let them learn about the contraceptives before they make a mistake. Let them know that they have a right to decide. They can choose what to use in order for them to be safe. Keep around. We are bringing so much more. Thank you for being with us. Again, we are in Yumbe, and we are glad to have one of the VHTs in this area who will be telling us more about contraceptive use in this area and a number of things that affect the young people, especially when it comes to contraceptives, and if they don't get contraceptives, and then what happens. We are happy to have you here. Please introduce yourself to our viewers.
Yes, by name I'm called Isaac Moro Moses. I'm the based in Yoyo catchment area. I'm also happy to hear this program. Actually, we have challenges a lot. Even with John Terry, even government, they say that John Terry is the leading of teenagers, pregnant, and we are still struggling how to rescue that scenarios, because most of our children, they normally get pregnant when they are still young, and we have a lot of school dropout because of the earlier pregnancy.
Sorry Sorry to cut you short. I just wanted to find out one thing. Just like you said, you're having very many pregnancies. One of the things as to why most of the young people become pregnant, which I think could be, is maybe they have no idea about their body or being able to make decisions for themselves, right? So I would like to know if the people in this area know about the right to their bodily autonomy, or knowing that they have this right to decide when it comes to their bodies. Do they know that they have this right?
By this year, they have no this program, because as you people, they are now on the ground. We are still engaged with them. We are interacting with some of them. We make our dialogues, our community meetings. We also updating them that if anything you want to know about your body, you can also come to the health center, and we shall guide them in terms of getting pregnant. How, if you want to get pregnant, how do you get? If you don't want to get pregnant, how do you guide yourself? Most especially the youths, we also encourage them to use the condoms, and the girls, they will use maybe a family plan. And at time when they have got maybe pregnant, in terms of maybe they don't know that it's going to conceive, and we also interact with them that for those who are wishing, for us we maybe for those who are maybe 3 months below, we also cancel them if they are ready, and then we also try to help them as they have agreed. Okay,
you have said that you're giving these people, you tell them to come to you in case they need something, right? What are some of the challenges that are faced by these young people when it comes to accessing these services? Talk about family planning or abortions. What are some of these challenges that they normally face in accessing those services?
The challenge normal, the person, at times maybe they can come for service, and at times they can not get the service. Maybe they will take long here, and maybe they even don't know who is concerned with this program. They just come, stay here in the facility, they just go without any service who have received. And for that guideline, the one, if you have conceived, maybe they don't know how to, maybe who is consultant for that program, maybe they will just come anyhow, like someone who is maybe feeling headache, what they just relax in there, and these are the challenge you also get. And normal, like me, the BST, at times I can also refer them, then they also come back to me and complain that they have come and they not get the service. So these are the challenges we normally face.
You earlier on you mentioned that it has been said that this zone has the highest teenage pregnancies. I think I hope I heard right. What do these young girls normally do when they get these unwanted pregnancies?
Because last time these funeral places for traditional people are used to dance, maybe they dance all the whole night. They dance there. Now the children, they are just moving anyhow at night. So even the rape cases, even we have these cases a lot. Even the general office, even the sub-county, it is aware for this thing. We are even making a sensation last week with the OPM. We did this sensation because we have a lot of cases of raping, and it is maybe this cost thing, but sub-county has come with the constitution and they have closed these things. By now, there is nothing like a disco and whatever. Okay,
now you're telling me like they have closed it, but what I would like to know is when this girl has gotten pregnant and they do not want the pregnancy, what do they normally do, like most of them?
For most of them who know the program which I start, because me I started is around 4 months back in this program, so they want to help them to refer to the facility, and then to get the services where like the one we are gathering right now, because I also can guide them in the, I have the referral, I also refer them. We have people who can guide them in the, maybe they can cancel them that if you wanted to maybe to make an abortion, they can give the procedures. If you maybe wanted to solve maybe the medicine or the inject the family plan, you can just choose. It is your choice. You can choose. If you say that you already have a pregnant, if you decide that you don't want, Then they can also interview like how many months do you have. If they say that maybe 3 months below, then this one will be able to be held. But if it is beyond now 3 months, meaning that it is now beyond.
Now, I would like to get your opinion on this thing. Between a VHT, you are the VHT, right? Between a VHT and a young girl, who do you think should be making decisions for young people? Between a VHT and a young girl, who do you think should be making decisions for the young people, in your opinion?
A young girl, around 12 below, or 15 above. According to the constitution of Uganda, someone who is 17 down, this is a child. So a child normally, they normally guide by someone who is adult, someone who is 18 above. They can able to guide a child with a right procedure that this when you do this and this, they will make for you this and this. Then me as a BST, I can also guide them as a children or a child. Me, I can say that for you, if you do this and this, meaning that it is not good, but you already do this and this one, maybe he will be the one to agree that he already do this one. Now he also in the mood of maybe not willing for the thing where they already did. Then I can also guide the procedure that if you don't want, maybe the right way we shall do this and this and this. Then we also help like that.
Thank you so much, VHT. Those were the views from the VHT telling us what is going on in this particular area when it comes to the use of contraception as well as abortions. So just like he said, this zone has been said to be having high numbers of unwanted pregnancies. What they do is most of them end up going in for unsafe abortions, just like the previous person had told us. But we are yet to find out from other people who will be telling us what do they use or how do they go about it. Thank you so much for watching, and stay around with us. We have one of the youth with us. We have been hearing from the leaders, the VHT, so now we want to listen to the youth. Let's hear the perspective of the youth when it comes to contraceptives and what is happening in this area. You are welcome.
Thank you so much.
Please introduce yourself to our viewers.
Okay, thank you so much. My name is Aima Musa, a youth from this area.
Okay. We are glad to have you, Musa. We would like to know a few things when it comes to young people or the youth, because we are all young people, right? Do you think young people in this area know about the rights when it comes to their bodily autonomy?
Thank you. According to me, young men of this area, mostly they don't know. Yeah.
How about the young women?
And young women too. Yeah.
So you think they all do not know? Okay. What do you think can be done for these people to know that they have a right to make decisions for their own bodies?
All right. If they don't know, it means there is something which they are lacking. So that thing there has to be done. First of all, there is widespread of ignorance here. So they need to be taught about their body autonomy. So they need to know more about it. And secondly, this young generation, they are not given chances to access such points. So it means their parents have to be sensitized about the importance of such occasions, such that they can come and express their views and ask what they don't know, then they are taught about it. Yeah.
Now, there is something that I would like to know from you. Do you think people in this area, especially the young girls, do you think they reach out to facilities for reproductive services? Let's say someone wants family planning, or someone has been faced with unwanted pregnancy. Do you think they go out to these facilities to look for these services?
Though there are some few accessing them, but most of them, they don't normally access them. Yeah.
What could be the challenges that hinder them from accessing these services?
The first challenge there is fear, because if they access those points, they will be coming out with the results, which if their parents see, they will be harsh on them. So that's the first thing. And secondly, they don't know the importance of this service here we're talking about.
You've talked about these young people fearing their parents, so it hinders them from getting family planning. Is that what you are saying?
Yeah.
Okay. Does that mean that a number of girls here do become pregnant because they are fearing their parents to go to the facility and get family planning? Does it result into those pregnancies?
No, it's not like that. Why I brought that one is because normally parents, due to religious factors, especially, let me say Islam, it forbids some of these acts, like use of contraceptives, like family planning measures, especially those pills. Now, when a parent who is faithful discovers that his or her child has used one of them, and that parent normally will become harsh on the child. Yeah.
Oh, when this child has refused to use family planning, the parent is going to become harsh on them. What if this girl becomes pregnant? What will the parent do?
Normally, when a girl becomes pregnant, our parents in this area, mostly, I don't know, maybe due to ignorance, they will forget that this child here still needs parental guidance. So it reaches a point whereby they will keep harassing this child. This will lead to that child negligence. You'll see to some extent whereby there are some children which are neglected. Maybe they are punished severely. That this will now lead to you'll see them dropping out of school. You'll see them running away. Some even do unnecessary abortions. So, yeah.
Now, there is maybe something that I would like to get from you. You've talked about some of them would do abortions. What do they use when they are carrying out these abortions?
In most cases, there are local herbs which they normally use. And these local herbs, of which most of them, they don't know the dosage. And their herbs here, since they don't know their dosage, after use of them, it may lead to some chronic diseases to them. At times even death, because they don't know the dosage. Yeah.
Now, when these people have carried out these unsafe abortions, do they always go to the hospital like after, or they stay home until they are fine?
Thanks for your question. So, going to hospital normally, when the abortion is safe, the only thing the young lady might be thinking of will be just aborting the child, not knowing that it might have side effects on her. So, the moment the abortion is safe, this young lady will not have time to access health center to make sure that her body is checked on the side effects of this very abortion. So it will now limit them from going to the health centers.
Now, you see, if we start talking about that, we can talk about that for the whole day, by the way, because a lot of issues around contraceptives and abortions tend to be very sensitive, and they tend to be wide because people have a number of reasons as to why. Now, according to you, Now, just like you to just tell me in your own opinion or what you think between a VHT. We know what VHTs do in our communities, right? Between a VHT and a girl, young girl, who do you think should be making decisions for the young people?
All right, thank you. If I'm not mistaken, a VHT is someone who is a little bit trained. So I think he or she, who is the VHT, could have something to otherwise tell that young girl about body.
So you think a VHT should be making decisions for the young people, in your opinion?
Yeah, because these young people mostly, they don't have that far knowledge about their body.
So assuming they have the knowledge about their own bodies, would this still be the VHT, or the young person can decide for themselves?
So if they have, I don't think there will be more need for them to go to visit the VHTs. Yeah.
Thank you so much, Musa, for your time and for your views. That is one of the youths here in Yumbe who was telling us his views when it comes to contraception use, when it comes to abortions in this area. So apparently, according to him, most of these people fear reaching out to the facilities because of, what their parents think or what their parents are going to do to them when they find out. And later on, it leads into, unwanted pregnancies, which will end up in unsafe abortions because they are scared for a number of reasons. There is a lot to find out when it comes to, a lot of these things in Yumbe in particular. Because why is this zone being said to be having high unwanted pregnancies? We shall be getting more about that. Otherwise, thank you for being with us, and don't go away. Keep watching Koirinet TV.